COVID-19 vaccines are safe and they work.
They've been through really rigorous clinical trials. The safety profile for the vaccines is no different based on age, gender, race, ethnicity, or if you have certain common comorbidities like obesity or diabetes or lung disease, that it looks like the vaccine is equally safe across these populations.
We have 2 vaccines that are going to be available to us immediately. One produced by Pfizer, one produced by Moderna. Both show about equal efficacy of around 95%.
The way we know that any medication works is by doing rigorous randomized controlled clinical trials. And that's what all COVID vaccines are going through. The COVID-19 vaccines are really critical to prevent infection amongst people, so that's protecting yourself, but then also to trying to reduce community spread, so protecting your neighbors. And that's really critical to reopening the economy, getting businesses going, and reopening schools. The vaccine, I think, is really critical for our communities of color, and I understand that there's hesitancy and potential distrust in the process. But the clinical trials that were done by the companies included a large number of individuals from a really varied background. And this was done specifically to try and address some of these concerns and history of not including communities of color in research. And I think that what they've done is by creating a very diverse population in our clinical trials, we can speak very specifically about the safety in these different populations. So specifically for communities of color, there is evidence that the vaccine is just as safe and just as effective as it is for everybody else.
In about 1/3 of people who get the vaccine, you'll experience a reaction, and that's because the vaccine is doing what we want it to do, produce an immune response. You may have arm soreness, you may even have fever, you may feel like you have a headache. Your muscles may ache. It may mimic a mild form of COVID-19 or the flu. It's an inflammatory side effect that just reflects the vaccine is working.
So just because the side effects are similar to the illness does not mean you're going to get COVID from the vaccine. It is actually impossible.
It's better to schedule the vaccine before a day off or when you don't have a lot of plans the next day, because you may feel some side effects from it and you'll want to have some time to recover from that.
So anybody that's had kind of itching with penicillin or a sulfa drug or has a food allergy to eggs or something should feel safe to get the vaccine. But what we do know is everybody needs to be monitored after they get the vaccine for a certain amount of time, and people that have had a serious allergic reaction to, say, a food may want to be monitored for a little bit longer.
Well, once you get the vaccine, we still have to wear our masks. We still have to be mindful of social distancing until we can ensure that the community has herd immunity and that this virus isn't circulating anymore. One day we will be able to get back to normal, but it won't be immediate. So I see this as the final tool in our toolbox. We have masking, we have social distancing, and now we have a vaccine. I see a way out of this pandemic.
I think the vaccines are a home run.